Welcome to Whoville on Earless Rabbit, Charlottesville's online television network. Today we have with us Dr. Daniel Pambianco. Dr. Pambianco is an associate with Charlottesville Gastroenterology. He's the head of endoscopy at Martha Jefferson Hospital, and he's also the medical director for Charlottesville Medical Research. Dr. Pambianco, welcome.
Thank you, Tom.
Dr. Pambianco, can you share your history and what led to your current tenure as an associate with Charlottesville Gastroenterology, as well as being the head of endoscopy at Martha Jefferson Hospital?
Yes, I was educated in the American University of the Caribbean and the British West Indies, and then I did my residency in internal medicine at Guthrie Clinic in Pennsylvania. And then I did my fellowship training here at the University of Virginia, and hence what brought me to Charlottesville. I was assistant professor of medicine for a number of years at the University of Virginia. I was director of the endoscopy unit there. And then before I went into private practice, which I've been practicing in Charlottesville for approximately 20 years now, and I've been a staff member at the Martha Jefferson Hospital, and I've been the director of endoscopy and the motility lab there since pretty much the last 10 to 15 years.
Dr. Pambianco, what is digestive health care and why is it important to someone's overall health?
Digestive diseases, as most of us are very familiar with, encompass ulcers, the disease of the stomach, gastroesophageal reflux disease, gallbladder disease, liver diseases like hepatitis. Most importantly, however, we're not only interested in treating diseases and diagnosing them, but also preventing them. And currently, we're very successful at treating and preventing colon cancer. But more importantly, prevention, which colon cancer is one of the most preventable disorders and diseases that we have. And in recent years, since we've been doing colonoscopies and looking for polyps, which are precursors to colon cancer, and their removal, we have shown a dramatic decrease in the incidence of colon cancer nationwide. So we're very much about prevention, and this is one of the few disorders that we actually have the opportunity to do so. So patients that undergo colon cancer screening really don't have any symptoms, but they should talk to their family physicians or their primary health care practitioners, and if they're not being encouraged by them, they should be encouraging them to refer them to have this screening process performed.
Dr. Pambianco, what do you think are the most important questions a patient should ask before receiving health care?
I'm a real proponent of patient-centered care, and what that means is that patients are the center of care for themselves as well as for their healthcare practitioners. And patients should be asking their practitioners, whether it be specialists or primary care physicians or healthcare practitioners, basically what is the plan? So it should be a partnership. It should be a team approach where patients and their healthcare practitioners together are formulating a plan to diagnose and solve the issues that patients come in with. And that encompasses coordinating their care. The questions for patients to be asking are, well, why am I having this test, and what are we going to learn from this test? And then what is the next step, and what is the whole plan? And also to understand the results of their test and understand the coordination of their care. So knowing that these results will be sent to their primary care physicians or the whole team of physicians that usually patients have these days.
Dr. Pambianco, you've been delivering health care for over 20 years in the Charlottesville area. How has your work affected health care on a broader scale?
In addition to being a clinical gastroenterologist, I'm also a clinical researcher. I started performing and being trained in clinical research at the University of Virginia, and I've carried that over into private practice. I've been the organizer and the founder of Charlottesville Medical Research, which is a clinical research unit of a group of professional people that help conduct clinical trials. And these clinical trials help advance medical science by developing new drugs, new devices that are innovative and help improve our health care. And over the period of time that we've been at Charlottesville Medical Research, we've performed about 300 studies over the course of the years, and this has led to almost every new drug that's been developed for gastroenterologic diseases such as reflux disease or peptic ulcer disease, or in the case of sedation for colon cancer screening, So we've been very active in perpetuating a concept of developing from the bench to the bedside care of patients. And on that note, it's very important that patients understand that their participation in these trials is very important, because we need to have volunteers for studies to undergo the results of how effective these drugs and new compounds that we use are. And so we perform these examinations and these studies in a very controlled environment to minimize any risk to patients. And volunteers are actually the true medical heroes, even more so than the actual researchers and scientists that help develop new compounds and devices. So my desire has always been to not only practice medicine, but to improve it and hopefully contribute to that.
Dr. Pambianco, thank you very much for being with us today. I've certainly appreciated having an opportunity to speak with you. If you would like more information on Dr. Pambianco's practice, you can visit whoville.com. Thank you, Dr. Pambianco.
Thank you, Todd.